What are some causes of birth trauma? Well, I mentioned before, hypoxia for any reason. Hypoxia for any reason. Whether it be a cord issue, whether it be a placental issue, whether it be something else going on within the fetus or within the mother, hypoxia for any reason. Prolonged or excessively quick or rapid labor. Either of those cases can become a problem. Prolonged because there can be repetitive contractions, contraction and contraction of the uterus, trying to push the baby through, and the baby can't go through. That can cause physical trauma because of the pressure buildup and the lack of ability to progress through treatment. Excessively rapid labor oftentimes doesn't have the necessary kind of squeezing and then relaxing type of thing, and therefore it's too quick. Whether it be vaginal or whether it be, you know, something's going on and now we're going to have a C-section. So the baby never had a chance to go through that kind of process. It was like, here you are, here you aren't, you're out. So that sometimes can cause or lead to potential problems. What can cause prolonged labor or birth trauma? Again, abnormal head size and maternal pelvis ratio, any kind of use of delivery assistance devices such as a vacuum extractor, such as a forceps, a breech position where something other than the head is presenting, an arm, a leg, a buttocks, whatever. C-sections, whether they be, you know, emergent C-sections or whether they be planned C-sections, and then oftentimes the drugs that are commonly used in labor and delivery. You know, the anesthesias that are used for the mother's comfort. Well, oftentimes what that does is that removes the mother's ability to know when she needs to push a certain way, and as a result she's not able to have a good feedback communication with her own body system, and therefore it's not as efficient a delivery, so that may prolong it unnaturally. Things like Pitocin stuff, which are supposed to help regulate and increase contraction of the uterus, that sometimes then you're kind of overdriving the system when maybe it's supposed to build up gradually in pressure. Maybe all of a sudden it's going from boom to bam, okay, a high contraction force, which is premature to what would have normally been the case. Yes?
How does a C-section cause a birth trauma? Is it change of pressure rapidly?
It's not so much it might cause a significant birth trauma, it's just that the normal process has been missed. So birth trauma in a sense, it's not like, oh, here's a big trauma to like overt, but the baby didn't go through a natural process, which many people would argue has inherently a purpose for setting up the normal rhythms and the normal mechanics in the baby's body. So a lot of times babies will be born with C-section, they'll have like the perfectly shaped head, but it never will have gone through like a cycle of compression, decompression, which some people feel is important for setting up the normal cranial rhythmic. Yeah, and there is again, remember there's feedback loops. There's a cascade tying between the pituitary gland, the hypothalamus, and the uterus. Yeah. And if the baby's removed prior to contraction and all that, you don't have a chance for that cycle to work its way through. So essentially what you're doing is you're interrupting a normal kind of natural phase cycle response. And who's to say exactly what the ramifications of that would be, short-term or potentially long-term.